Hi, thanks for scanning the QR code. I'm Kate.
And I'm Kathy, and together we are the team at Thrive Aged Care Consultants. Now, we started Thrive Aged Care at the start of 2023 after over 20 years of experience working in public health, community and residential aged care in a variety of different roles. I'm a nurse by background, Kate's an OT, and together at Thrive, our mission is to share our knowledge and expertise to help support those who care for older people so that they can thrive, and then in turn, their clients that they care for can also thrive. Now, we're committed to changing the way that we provide care and services for people living with dementia. Having worked in the area for over 20 years, including myself running a secure dementia assessment unit and setting up a community program for people living with dementia, we thought we had lots of skills and knowledge in this area.
We did, didn't we?
We did.
We did. And that was until we found dementia guru and OT Teepa Snow and her positive approach to dementia care. And that was our aha moment. You know, we had done a lot of training in dementia care and we thought we knew everything. But Teepa's approach, the positive approach to care, really takes a rehab focus. So, you know, it really views dementia as brain change. And it gets us thinking about what we should do to change our approach to meet the changes that's happening in that person living with dementia's brain. Yeah, and how we adapt. So we meet them where they're at and how we can tap in and connect to what strengths and abilities that they have left in a really positive approach. So, you know, we believe that this is the way, this is the direction that dementia training needs to go. Yeah. So we, without some members of our team, we've undertaken the training directly from Teepa herself, and now it's so exciting that we're certified to teach this approach to other people.
It's amazing. This is different because it is a hands-on practical approach and it teaches simple yet evidence-based techniques to give power back to the person living with dementia. Like Kate was saying, really focusing on abilities rather than what the person can no longer do. So this means that carers and the people that they're working with have a more positive experience. And we know from our own experience that this means when we have better interactions, that we see less agitation, that we see less behaviours from the person living with dementia, and staff feel more confident and experience more positive interactions and more positive relationship between the carer and the person that they're caring for.
Yeah.
So for the organisation, what does this look like? It looks like less code greys, less OVA incidents, less complaints, and even less or reduced use of psychotropic medications that we often see used to manage responsive behaviours.
Exactly. Yeah. Now, we've been running this training this year and, you know, we've been blown away by what we're hearing from participants. Not only are they telling us that it's the best and most relevant practical training that they've attended, but they're coming back and telling us that they're actually going back to their workplaces, trying out their new strategies and techniques, and that they're working. And that their colleagues who haven't attended training are saying, can you teach me what you're doing, you're doing differently? You know, and they're seeing that these techniques are improving their daily interactions for the people living with dementia that they care for, even those residents that have been known to be aggressive. So that these techniques are helping people with daily things that sometimes can be really tricky for people with dementia, like having a shower or personal care or helping people to eat. But they're getting more positive interactions that are leaving staff feeling really confident and, you know, wanting to go to work, wanting to try something new and to support people living with dementia a little bit differently.
And that's just not just resi care, it was acute care as well, wasn't it, Kate?
Yeah. Not just residential care,
because people living with dementia are in our community and we care for them in every one of our services.
Exactly. Now, there's a lot of dementia training out there, which is awesome because the sector knows that we need to focus on dementia as a specialty. It is a specialty, okay? However, is this training changing practice? Is it improving outcomes for people living with dementia? Is it making your staff feel more confident and capable? Is the training practical and hands-on? And is it translating into, a better care, better support for people with dementia.
I think it's a really good point, Kate, because we know that there's a lot of training out there that is often pre-recorded webinars, and that's a really convenient way for us to get access to a large group of staff, and it has its place. But, you know, dementia care is a specialty. It is a national priority. There is a lot of knowledge and skill that is required to support people living with dementia. So how do we learn these skills? You know, as nurses, we don't learn how to put in a catheter or a IV cannula by watching a pre-recorded webinar. We learn that through practical training. And it's the same for caring for people living with dementia. It is practical skills that we need to learn. And the way that we need to do that is in a supportive environment, because when we are caring for people living with dementia, we're often providing intimate care. Yeah. So it's not a skill that we can learn by watching a video. It's something that we need to have interaction with, that we need to be able to learn in a safe space.
Yeah, exactly. So we would love to have the opportunity to come out and tell you and your board members a bit more about a positive approach to care, a bit more about this new, different, hands-on, practical, evidence-based dementia care training methodology, you know, because we believe that this will really change the experience and the outcomes for your teams and the people with dementia that your service supports. So all we need is 20 minutes of your time. You know, 20 minutes, we'll come out and we'll show you what is different about this training, and you'll see how it's going to make a different outcome at your services. So thank you again for, you know, taking that leap and scanning the QR code. Thanks for meeting us. And, you know, we hope that you get in touch so we can tell you a little bit more about this approach. And, you know, we can all start thinking about supporting people with dementia a little bit differently to get more positive outcomes.
Thank you.
Great. Thank you.